Welcome to Dizzy Therapy. I'm Anthony Veglia, but a lot of patients call me Doc. I'm a doctor of physical therapy who specializes in vestibular rehabilitation, which means that I treat patients with dizziness, imbalance, and vertigo 40 hours every week. Let's talk. So you're scheduled for your very first visit with a physical therapist for vestibular rehabilitation. What should you expect at your initial evaluation? Right away, I'm going to actually split this into two categories. One is for the majority of vestibular issues, mostly talking dizziness and imbalance, and a totally different kind for positional vertigo specifically. For both types though, let's just start with talking. You are the only person in the world who knows what your symptoms feel like to you. By the time that I meet with you, I'm going to have some history most likely, and probably your test results too if you've had proper vestibular testing. But how does it affect you? When did it begin? What does it feel like? How would you best describe it? What does the issue get in the way of? Does it bother you to drive, to exercise, to work on a computer, or see a scrolling screen? I've had many patients come written notes about how the symptoms have changed over time or what parts of their day-to-day it's interfering with most. That stuff really matters to a physical therapist. So for diagnoses with dizziness and imbalance, I'm going to be putting a very stylish belt around your waist for safety, and then I'm going to be hanging on, and we're going to test your balance. We're going to be doing standing tasks, walking tasks. I want to see how do you handle fast head movements or see complicated visuals, if that's a problem for you. The tests I give you depend on what you tell me about, but as I mentioned, it has to be through a lens of your needs. I had a 75-year-old patient with Ramsay-Hunt syndrome who just wants to feel safe driving again, and an 18-year-old who was trying to qualify for the Olympics in artistic swimming. They're going to have pretty darn different levels of intensity applied to them. So don't be too intimidated by the sounds of these tests. Specialists like myself, we're used to treating people at all levels of intensity and challenge and age. But no matter who you are, be ready to have challenge on your first day. My job is to find where are your limits right now today. As we continue with therapy, we're going to keep trying to push your limits higher and higher until they are where they used to be in the past. Come dressed, ready to move. Particularly, some good shoes is pretty important when we're testing your balance. I've had patients show up with combat boots. I had one particular patient show up with 6-inch stilettos on for their first day. Not exactly ideal. During these tests, if you're feeling extra dizzy, let's take a break. If the legs are getting shaky, let's sit down for a moment. There's no worries. That's not unusual. We're prepared for it. Just let me know. By the end of your initial evaluation for vestibular rehabilitation, I want you to know your diagnosis. I want you to be able to put a name to it. I want you to know what are we going to do about this to improve your dizziness or imbalance. And I want you to have some homework to get it improved. Personally, I don't give tons of homework. I don't give more than 2 or 3 exercises, 5-10 minutes a day. And I always make a printout so that you don't have to remember a single thing. If I give you 40 things a day, you're probably going to do about 0. Now that's an evaluation for most vestibular problems. But what about positional vertigo? Despite the fact that BPPV is the most common vestibular issue, the treatment for it has almost nothing to do with the treatment for any other dizzy issues. To get rid of positional vertigo, come prepared for symptoms. You have to go into vertigo during the testing and treatment for positional vertigo. There are a bunch of tricks to help make it as easy and tolerable as possible, but come dressed, ready to lay on your back, your side, your stomach. Some people go down to just their socks on the table, and the details depend on your case. Depending on your personal symptoms, maybe don't have a big meal beforehand. Many of my patients will leave BPPV treatment feeling good. 25% or so do need to take it a bit easy for a few hours, maybe the rest of the day. But because of the nature of positional vertigo, the test goes straight into treatment and often 1 or 2 visits, and it's completely clear. To summarize this, your first visit should be challenging. You have to have your symptoms tested to know how we're going to get better. But safety is absolutely going to be important and emphasized. But the process of vestibular rehab, and really physical therapy and exercise as a whole, it's about challenging your limits in a controlled manner and progressing more and more until you reach your goals. So stick through that first day because it really helps. Other types of exercise, you get your muscles burning to get them stronger. You get out of breath on a run to gain endurance. And in this case, you're going to get a little off balance or a little dizzy to get rid of dizziness and imbalance later. So with that, you should be ready to step into your first day. Depending on the clinic and the provider, there may be some details that are different, but in general, find your limits, push them where they should be, or in the case of positional vertigo, stick through that crazy treatment to get rid of it completely. Thank you so very much for watching. Always stay curious about these incredible bodies that God has designed for us so well. Leave a question in the comments below because I would love to know what you all want to learn. Subscribe to Dizzy Therapy for more videos in the future. And remember, dizziness, imbalance, and vertigo are never normal. So visit your ENT and vestibular physical therapist as soon as possible so you can get back to moving freely. Have a great rest of your day and may God bless you with stability throughout your dizzy therapy.